Good afternoon, everyone. My name is Janice Whitaker. I'm the administrator for CGNE, and it's my pleasure to host the seminar series. I'd like to introduce Jenny Rank. Jenny is our education program specialist who does a tremendous amount of work behind the scenes to set us up for success with the seminars. And she also helps to facilitate a lot of the technology and participate in the Q&A portion. So we appreciate having Jenny on board on our team. But this program is presented by the Teresa Neese and Helen Diskovich Center of Geriatric Nursing Excellence at the Ross and Carol Neese College of Nursing in collaboration with the Office of Outreach and Professional Development, the Center for Nursing Research, and Age-Friendly Care Pennsylvania. Today's seminar, Use of Virtual Reality in Nursing Simulation to Explore Caring for Patients with Dementia, will be co-presented by Dr. Vicki Kellogg and Rebecca Weaver, faculty at Penn State Ross and Carol Neese College of Nursing. So first, before we proceed, we do have some disclosures and announcements to make. Penn State Ross and Carol Neese College of Nursing is approved as a provider of nursing continuing professional development by Pennsylvania State Nurses Association, an accredited approver by the American Nurses Credentialing Centers Commission on Accreditation. Participants with a valid RN license who attend the entire Nursing Continual Professional Development Program can earn 1 contact hour. Partial contact hours are not awarded. To earn contact hours, Zoom in and out times will be recorded, and the post-event evaluation must be completed within 1 week of the seminar. Certificates will be emailed to RN participants meeting all requirements within 1 month following the seminar. As a reminder, the seminar will be recorded, and we do post these recordings on YouTube. So if you miss any and you'd like to have access to them for your personal use or for any courses you're teaching, please take a look at those. If you have any questions during the seminar, your questions and comments will be addressed. You can enter them into the chat feature, or you can raise your hand at the bottom of your screen and Jenny will unmute you so you can speak aloud. And again, the post-evaluation link, we're encouraging everybody to complete the evaluation. The link itself will show up in your browser when the webinar concludes. It will also be emailed to participants within 24 hours. Again, it's required for RNs, but we do ask that all attendees complete it to assist with our data collection. And if you have any questions or concerns, you can always reach out to cgne@psu.edu. So now it's my great pleasure to introduce Yojan Lau, one of our wonderful affiliate graduate students in her 6th year of her PhD program. She's had a couple of major life events during her program, and we're thrilled that she is an important part of our team. Yojan has focused her dissertation on licensed nurses' assessment of pain in people living with dementia that are residing in long-term care. And thanks to Yojan for introducing our speakers today.
Thank you, Janice. Vicki Kellogg is an assistant teaching professor at Penn State Altoona. Prior to her tenure at Penn State, Dr. Kellogg practiced as a nurse attorney, specialized in the defense of healthcare organizations, providers, and nurses. Dr. Kellogg has also worked as a women's health nurse practitioner in a community clinic and a registered nurse in a variety of settings. Rebecca Weaver is an instructor of nursing at the Ross and Carol Neese College of Nursing at the Penn State Altoona campus. She teaches the gerontological nursing course to undergraduate nursing students. Her nursing background includes medical, surgical, palliative oncology, and emergency trauma nursing. Thank you.
Thank you, Jen. I'm gonna go ahead and share our screen here. Okay. All right. So again, thank you, Jen, for your introduction of us. So today we will be presenting a PowerPoint on our experience of implementing virtual reality in a pre-licensure nursing program to help teach dementia care. The objectives of this presentation will be to define and discuss dementia, to define virtual reality, and to discuss considerations when implementing VR, and to discuss our experience implementing a dementia-related VR scenario in a pre-licensure nursing program. So on this slide, we'll have a brief overview of dementia. So dementia is a general kind of overall umbrella term that describes a loss of memory, language, problem solving, and other thinking abilities that are severe enough to interfere with daily life. So educating pre-licensure nursing students on proper dementia care is an important component of their education. As a part of their gerontological clinical rotations, our students do have the opportunity to provide care to residents living in a memory care unit. However, looking at the expected increase of people living with dementia, nurses will be required to provide healthcare to these clients in a variety of settings and at an increased frequency. So our goal is to teach these pre-licensure nursing students how to provide care to those living with dementia competently.
Okay, so first, before I begin, I just want to apologize for my lack of formality for presentation today. I am actually coming directly from clinical today, so I am in my clinical garb, and my students who are around, hopefully, hello to everybody who's on the web, and my students who hopefully are on as well. So I just want to talk a little bit about virtual reality and why we decided to implement this program. So nurse educators, as we know, face multiple challenges educating nurses. One is educational demands for technology. So many of our nurses that we're training today in the pre-licensure program have never been in a world where educationally they have not had a computer. So some of us remember the dial-up days, the typewriter days, documenting in paper. Some of the students that we are now teaching have never not known what it's to have a smartphone right with them. Don't know what it's like not to have Google at their fingertips. So they are expecting technology and they're demanding it as they go through education. Second, clinical sites are becoming more and more limited as more educational facilities are seeking clinical sites, whether it be nursing programs, PA programs, therapy programs. There are becoming shortage of clinical sites for us to go out there, especially when you look at the specialties. So if you look at pediatrics, OB, geriatrics, there's limited sites either because there just are not in the community or to be able to get into a clinical site, such as a geriatric long-term care facility. It takes quite a while for the legal backgrounds and the educational backgrounds for us to be able to use them. And then finally, faculty nursing shortages. There is a shortage in the number of faculty to not only teach didactic classes, but also clinical classes. Simulation, as we think of it, we've been using for quite a while in nursing education. So most of the times when we say simulation, our minds, at least mine, goes to looking at mannequins, high fidelity simulations that I know we have in our program here at Altoona. So simulation allows students to be able to practice skills, practice communication in a non-threatening environment where it's okay to make mistakes because a real patient is not there, so they cannot do any patient harm. Also, when we do simulation, they have the opportunity to try different communication styles. Try, if I've never put a Foley in, what is the best way for me to do it individually? And then we as faculty are there to give them feedback to say, okay, this works really well. In our practice, this is what we do. Here are some suggestions. Here's what the evidence is showing. So it allows them to learn in a non-threatening environment where they can't do any harm and they can get positive feedback so they can work on that skill improvement. So virtual reality uses a variety of immersive, high visual 3D characteristics to replicate real life situations and/or healthcare procedures. So this allows us to basically imitate a healthcare scenario or a procedure so that they can practice it similar to the way that they would do in a high fidelity situation. Just by some kind of references, because I know that there's a lot of terms out there. Virtual reality aims to create a virtual experience in a headset where the user is in a virtual environment. So this is when you get fully immersed into another world almost. So you see a lot of gamers who go into virtual reality to play games such as Saber Beats. In this, for our scenario, what they did is the students put on the headset and they were fully immersed in a ER bay taking care of a patient with dementia. So they don't see the environment around them, they see an ER with a patient in front of them. And then you have augmented reality, which we did not do, but I'm just kind of using it for definitions here, which basically augments the physical world and the digital artifacts by putting images, videos, experiences, and overlaying this with computer generated images. So it's more of an overlay to reality. And then there's mixed reality as well. But again, we focused ours on the virtual reality part of the technology. So just by way of background, I want to give you kind of an idea of what, when we say virtual reality, and I say, okay, we put the students in a headset and they're immersed within the reality of the e-dog in this particular situation. What exactly does that mean for the hardware? So on the screens, you have on one side, you have the MetaQuest 2, which is on the left side, the MetaQuest 3, which is in the middle, and then on your right side, you have a computer screen. So there are many companies right now that are making VR hardware. So Sony is another company that makes them. Here at Penn State, at least from our experience, Meta is Quest are the ones that we've seen. At our campus, we have Meta 2s and Meta 3s. I know Media Commons that you can borrow some of the equipment from. They're moving towards getting the Quest 3s, and I think some of the other campuses have the Quest 3s. As you can imagine, the Quest 3s are the newer version compared to the Quest 2s. And we do have to thank the College of Nursing because we received a grant about a year and a half ago to purchase the Quest 3s for use at our campus. So what's the difference between the Quest 2 and the Quest 3? Because again, both you can see those at Penn State campuses. Well, one, when you put the headset on the Quest 3, you see the environment. So if I were to put one on right now, I could see Rebecca sitting here. I could see the conference room I'm in as a pass through. On the Quest 2, I can still see everything, but it would be in a gray, black and white screen, whereas in the 3s, it's all color. In the Quest 3s, there's more pixels, so the images and the pictures are crisper. In the Quest 3, it's a faster processing, which allows for better use of some of the software, and if some of them are gamers. Difference between Quest 2 and Quest 3, if you look at the headsets in the one on the left and the one on the right, they're actually about the same weight. But when you put on a Quest 3, it's balanced and it's more compact so that when you're putting the headset on, it's more comfortable for the students to wear. And then the last thing, price. The difference between Quest 2 and Quest 3, as you can imagine, the Quest 3s are more expensive, but the difference depending upon the site is about $200 if you're looking comparatively. In addition to the headsets, what we also found is that you need some way to clean these. So either having an ultraviolet light machine to decontaminate them, or we use antibiotic wipes at our campus because what we've found is quite a few of our students, even if we ask them not to wear makeup, fragrances, mascara, still continue to wear them. So that allows us to not only sanitize the headsets, but to remove the makeup as well. Now you're thinking to yourself, okay, that's great. What if I have a student who doesn't want to put on a headset, either because they are not interested in doing virtual reality or they have a medical condition that doesn't allow them to use it? anything that we do for virtual reality in our implementation of the project allowed them to do it on a screen. And that's why I have a computer there. So if they use the computer, I think we did have one student over the course of this project who, because of an inner ear issue at that particular time that we did the scenario, decided to use the computer. And in this case, she went through the same scenario, had the same experience from taking care of this patient with dementia. It's just that it was on a computer screen as opposed to being immersed within the virtual reality. So the next slide, these are just a couple of slides from different Oxford Medical Simulation or OMS of different scenarios that they have. Once you purchase the headsets, or like I said here at Penn State Media Commons, you can borrow headsets. And I know that at the campuses in the Commonwealth, there are different headsets at each of the campuses. But once you get the headsets, what really costs the money in a lot of terms is the software. So for OMS, we found that the software costs anywhere from like $100 or $50 to $100, depending upon it. In this particular implementation project, it was $50 for the scenario per student. And like I said, these are some of the screenshots of different scenarios that OMS has. At our particular campus, we are very fortunate because as nursing faculty, our background is nursing, and that's what we're here to teach. While we can do the technology of it, we partners with the information science and technology departments. So as part of their program, their students are required to do an internship. So we had students do their internships to support us on the technology side. So we had an IST student who did all the updating for the equipment. At the end of the scenario, the IST interns would take and decontaminate the headsets. They would change the batteries. They would make sure everything was charged and ready to go. We did this as post-conference, which was 12 to 2 p.m. They got there at 10:30, 11 to get the room set up, get the equipment in the room, so that when we arrived, we were ready to go. So it allowed us to just focus on teaching nursing and not having to focus on the technology and making sure everything was set up. Further, when we were actually doing this scenario with the students, they were in the room, so if they were kicked off the network, we could continue to teach the nursing background and they would put the headset back on the network. Or if the student didn't understand how to use the hand controllers, they were there as the technology backup piece for us. And then next, I'm going to just talk about some considerations space. So I'm sure we all know that space is a premium, not only at Penn State, but probably any organization I've ever worked at. So what you typically want is about 6x6 to 6x10 area to do simulation. If you're doing a multiplayer scenario, you're going to need a bigger space than a 10x10 is what they suggest. You're also going to need more bandwidth. So before you do a multiplayer, make sure that your organization can support it from its bandwidth. For our particular implementation of this project, they were all single use. So one student took care of the patient. So each of them had their own scenarios as opposed to being a multiplayer. As you can see here, these are two pictures of students that we have at our campuses going through virtual reality. The one on the left, that was taken in one classroom, and the one on the right was taken in a classroom in the computer science part of it. And as you can see, what we do is we have the chairs or the tables moved to the sides, and then we use the classroom as where we do virtual reality. I know some of the other campuses have bigger areas that they do for virtual reality, or they reserve the gymnasium. For us, because we were doing this as part of our post-conference, it was easier for us having the smaller groups of 6 to 8 to be able to use a classroom. As you can also see in here, on the one on the left, the students are standing, and the one on the right, they are sitting. So you can do either way for when you want to do virtual reality. In either situation, whether or not they're sitting or standing, the students set up boundaries. So if, for example, the ones on the left, they walk outside their boundaries. They are no longer seeing the ER bay where their patient is being taken care of. They're seeing a black screen with blue lines coming through it. The same way on the ones on the right, when they're sitting, because those chairs are on wheels and are able to move 360, they can still scoot throughout the ER bay and move completely around, but it allows them to have a way to sit. So we gave the students options to go in both ways. Most students preferred to sit just because it helped them to get used to the virtual reality. And for many, at least our traditional GNER students, many of them have used virtual reality at home, either for video games or for movies. So they were very familiar with that and they preferred to sit. So that's why we gave them the option and they could choose either which way they wanted to go. So just kind of talking a little bit about the implementation in the course. We implemented this course in Rebecca's 310 geriatric course, which is therapeutic nursing care of older adults in a variety of settings. And we did this as part of our dementia simulation as part of a post-conference. So as part of Rebecca's course for their clinical, they do one of their clinicals in a long-term care facility that has a dementia care unit. So they get the clinical opportunity to take care of a patient in dementia, but we gave them this scenario so that they could practice before they go into the dementia care scenario, so that they had some familiar terms and way to interact. The students completed the Oxford Medical Simulation scenario, and that each clinical group did this as a post-conference. So rather than doing a post-conference at clinical, they came back to Penn State Altoona into one of the conference rooms and we did a post-conference there. So how did we implement this, which was kind of the crux of our presentation? So prior to doing the VR dementia simulation, the students got all of the information and were taught about dementia in Rebecca's course. So she did the didactic portion of it where they were to read the information, and then she came in and she taught them in the classroom. The week prior to their assigned date to do the VR simulation, they were to review the course material. So it was specifically put on our Canvas site. Rebecca had reviewed this and she had all the dementia material that she went over, the slides, some additional reading information for them to review. Then by 5 p.m. the night before their VR dementia simulation, they were to complete a concept map and then submit that to their clinical instructor. Third, before coming to the post-conference, they were to watch VR orientation videos. So we put all 3 videos on Rebecca's Canvas site for her class. So one was a short YouTube video on the VR equipment. It showed them what a headset looked like. It showed them how the handsets work. I think the video is maybe 3 minutes. And then we created short videos. One is how you connect to the Penn State network. So when you put on the headsets, how do you get onto the Penn State network so that you can access OMS? Or if during the scenario you get bumped off the network, how can I get us back on the network? And the other one was just a short video on how to access OMS. So the students would put the headsets on, connect to the wireless system for the internet, and then how they got connected. So our post-conference was 120 minutes. The first part of it was an orientation to the equipment and to OMS. So the first one, like I said, they already watched a video on what the equipment looks like and how to access OMS. But here's the time where we say, okay, here's a headset, touch it, feel it, put it on your hands so you're used to it. And then the second most substantial part of this orientation period is a tutorial of OMS itself. So when we do regular simulation in the high fidelity lab, we take the students into the lab. Okay, here's the mannequin, here's your equipment, here's how you use the equipment, here's your par room, so that they become familiar with the situation that they're in and the care environments. Because as you can imagine, any of us going into a clinical situation in a new environment, you're having to learn where everything is, in addition to taking care of the patient. So we wanted them to be able to go into this ED bay and be able to know, okay, here's how I do a blood pressure. Here's where my patient is. Here's how I access my patient's information. So they went into OMS and completed the tutorial where a PCT basically showed them around the room, and then they practiced getting a blood pressure, practice getting a temperature, practice talking with the patient, practice accessing the computer. Once that's over, and that takes 30 minutes at the long portion of it, we do a pre-brief. So as I said, all the students completed their individual concept maps. In the classroom we had a big chalkboard. So as a team, they completed the concept map. So they put it all up on the board and they drew it together. So depending upon if the particular group was more visual, some of them did big circles and then put different hours out to the different parts of a concept map. Other ones were more like we would do traditional, whereas put in kind of a box and columns. But they worked on that together and kind of talked through it. And then we talked through the individual OMS scenario. So I gave them the information that 78-year-old male with a history of dementia presents to the emergency department agitated after being found wandering. He's confused, irritable, and combative. Okay, so this is your patient. How does that fit into the concept maps? What assessments are you going to do? What is the priority of your assessments? Why is it a priority? What interventions do you have to do? So we're kind of talking through all that and using what they have up on the board. That takes about 30 minutes, and then they go through the OMS scenario itself. So they enter into the headsets to go into the virtual reality. This slide's just to kind of show you what OMS provides for you. So this is OMS's handout on dementia. It gives you a little bit of the summary, the objectives, the assessments, and really what's at the end of the scenario from OMS's standpoint they should be able to accomplish. So at the very end of it, we do a debriefing, which at the end of OMS, the students independently debrief. So the OMS scenario asks them, what was your impressions? What do you think went well? What could you do differently? And it allows them to reflect individually on how they think they did in the scenario. So it wasn't something that was made public. We were able to access kind of how well they did, but it was not something that, oh, you forgot to do this assessment. This is something that they looked at to say, okay, how am I feeling? There's also at the end of OMS where you get to go through and here are all the objectives and all the assessments, basically what we saw on the sheet prior to this. Did you accomplish them and did you not accomplish them? And it allowed them to kind of go through where in that scenario they were able to accomplish the objectives to the assessments. What assessments did you not get to? And then we had a group debriefing where we went back and we go around. So, okay, what did you think went really well? What do you think we could do differently? And then we used the concept map again. And I said, okay, so we talked about this before. Now you actually got to take care of this patient. What did you see on this concept map that this patient exhibits? What assessments did you do? What assessments do you think you would do next time? How would you communicate differently to the patient? What things would you implement when you're looking at taking care of a patient with dementia in your practice? So now that you've taken care of this patient, how is this going to change your practice? What are you going to do? And that takes about 30 minutes to discuss how it went and to make sure that at the end they all feel a positive experience having gone through the simulation. And then we have them do the sim survey, which is the same sim survey that we do at Penn State for any of our simulations, whether or not they're high fidelity or virtual reality.
Okay, thank you, Vicki. So on this slide here, we can see the results of the post-sim survey that the students completed. So overall, generally, the students had a favorable use of VR in the OMS simulation to help them understand how to provide care to a client with dementia. So about 91% of our students agreed or strongly agreed that they feel better prepared to care for real patients. 86% said that they were confident that they mastered the simulation content. 83% percent also said that they are more confident in their ability to recognize changes in real patients, and 91% said that they did want to see more VR experiences added to the nursing program. The students also had the opportunity to kind of type in their own comments that they wanted to share. So Vicky put on the slide here some comments that she pulled out of the SIM surveys, and it said that students said that it improved their knowledge on caring for patients living with dementia. It did help simulate what it would actually be like to maybe care for a patient living with dementia. One student did say it was good, but sometimes it was a bit overstimulating. Since these surveys are a little bit are anonymous, we're not sure if the student was maybe referring to use of the actual VR equipment was overstimulating, or if caring for a client living with dementia was the part that was overstimulating. And finally, another student said that they were able to make mistakes in a safe environment, kind of reflecting what Vicky had said earlier. After the students had completed this VR scenario, I did ask them in class in the following weeks what their experience was and how they felt about using VR. So candidly, they said that they had a lot of fun using the VR. Again, they wish they had more opportunities to use VR. And then they liked also how the simulator gave them that personalized overview or debrief of what went well and what they could improve on in future VR simulations or in actual care environments. This project was implemented in 2 semesters, the fall of 24 and the spring of 25, but unfortunately the data for the fall 24 cohort was unavailable for evaluation. So these surveys results that you're seeing here are solely for the spring of 25. And overall, the use of VR simulation does reinforce didactic and clinical experiences for our students. Okay, we would like to acknowledge and thank the Teresa Neese and Helen Diskovich Center for Geriatric Nursing Excellence for their support in the purchase of the OMS software. And we would also like to acknowledge and thank the Ross and Carol Neese College of Nursing Center for Nursing Research for their support in the purchase of our VR equipment. On the final slide here is a QR code for our references if you would like to scan that.
And we welcome any questions that you might have as far as how we implement it, or any suggestions if anybody else has implemented it, their campus or their organization, as to what they found worked well, what worked better, how we can improve it on our side as well.
Fair enough. Thank you.
I think you're muted.
Yes, I am.
Okay.
It just popped up, and yeah. Thank you so much, Vicky and
Thank you,
Rebecca,
Denise.
for an amazing presentation. It's fascinating. I had a faculty member ask me about virtual sim yesterday, and I had limited knowledge, so I'm thrilled to learn about how this has been implemented. You did a great job explaining how it works, and the visuals were super helpful. So thank you so much. To our participants, if you have any comments or questions for the speakers, as a reminder, you can put them into the chat, or you can raise your hand and Jenny will unmute you so you can speak aloud. Khalid has, one of our faculty members has put some comments and questions into the chat. He says, great presentation. Do the NCSBN approve virtual reality as a replacement of regular simulation or clinical hours? He's also asking, did any educator or student have complications such as motion sickness or other symptoms? And how did you give them the scenario before VR on simulation day? So I guess the first question relates to NCSBN.
Sure. So as far as I'm aware, the NCSBN does not take VR simulation in lieu of doing actual clinical hours. I am actually unsure if we are able to use VR in place of sim hours. I don't believe there would be an issue with that, but I can get back to you on that answer.
That's I'm leaving that to my course coordinator in that. As far as students who had any issues, we did not have any students who had any issues. Like I said, one had an inner ear infection and just didn't want to risk it with the virtual reality, so that's why they used the headsets. In the fall, we had our junior students who are more of our traditional students, so think traditionally in the early 20s. In the spring, we have our second, or I might have reversed it, but the last one we did in the fall, we had our second degree students. So they are traditionally older because they come with already having a degree in place. Both sets of students did really well with the virtual reality. For me personally, I find it easier to stand, but we found a lot of students sitting down kind of helped with the motion sickness, and especially with our junior students, were more used to sitting, and I'm not sure some of that's because they said they game and that's how they do it, or they watch videos online on YouTube and they're just used to sitting. So we gave them the option for whichever way they wanted to do. And as part of our IST intern, part of his job was not only to make sure the technology worked, but the faculty member and the IST student made sure nobody would bump into one another to get injured. So that was kind of just a support system that, we set boundaries. If you're outside your ED area, you'll know right away because you'll go from being in the emergency department to be in a black space with blue lines. But we were walking around just to make sure that nobody would come in contact with one another. And can you repeat that last question? Yeah,
Sure. Just a quick comment before I do that, related to the sitting, standing, I was curious as to whether you gave them that option, and that's a really important aspect to increase their comfort and give them that choice. It's fascinating that most of them, chose to sit, but I probably would too, actually, the first time around. But that's great. I think, increasing their comfort level, and also that observational aspect of it, that you as in the instructor, as well as the student, the IST student, were monitoring just to make sure, for safety purposes. That's great. And the last question was, how did you give them the scenario before the VR simulation day? I guess curious about
we didn't.
whether there
So
wasn't a
they
simulation
knew now. So
previous.
they knew
Okay.
they were going to do something with dementia because they had a come in having reviewed what Rebecca taught them and to do the concept map. So they had an idea. So they just weren't in there blind. And then we gave them the scenario and then we went over, okay, so you're taking care of a patient with dementia. What assessments would you want to do? Okay, so they're agitated. What's the priority? Which do you want to do first? Which would you want to do second? Okay, so they're becoming combative. How do you protect your patient? How do you protect yourself? So we talked through that part of it before they got into the scenario. And then once they're in the scenario, they're the nurse themselves. So when we do, at least at our campus, high fidelity simulation, they work as a team. In the OMS scenario, they're the nurse and then they can call different people for assistance. So if they were in the room and wanted to go and make a phone call to talk to a provider, they could call a nursing assistant in to keep this patient safe while they went outside the room. Or if they were going to turn their back to use the phone, okay, who are you going to protect your patient? So if they're becoming combative, how do you protect them, remain safe, but how do you also protect yourself? So while they're on the litter, you can move yourself forward and backwards with
So
that.
as you're describing this, it sounds like each student's experience can be unique depending on
Yes,
the decisions they're making in the moment
correct.
as they're working through their assessment, as they're dealing with different issues that come up within the situation.
That's
Yes.
very cool. That's
Yeah.
great.
Thank you.
We actually have two hands raised. So I think we'll start with, we have a group at USB 2 that's raised their hand. So we'll start with them and then Dr. Mike Evans will go second. So let's unmute USB 2.
Yeah, thank you. This has been an exciting presentation. It's been my first time to be exposed to this. I think it's a wonderful project that can enhance our teaching and learning in nursing. I have a question concerning you. You have done debriefing after the simulation exercise. I wanted to know whether there is some form of some risk assessment form that they normally utilize, and those who reported that they made some mistakes, which kind of risk assessment they would have make, and how would they have, addressed it before, calling for assistance and all that. Can you touch on that? Thank you.
Sure. So thank you for the question. In this particular project, we were just focusing on the implementation, how we would go about doing it, as opposed to looking at a research tool. And so we only did the sim survey that we do for every simulation. If we were going to do this again, we'd put in some more tools and kind of look at the research part of it. From that aspect, we are more focused on the nuts and bolts of how we can put this into a class, and do the students like it? Is this something that we should be focusing on? Right. The students, they get their from us at the end. It's a private, okay, you forgot to do this assessment, so they could go through it. And then as we were talking as a group, if they had a situation where, I don't really know how I should have handled the situation, and then we could talk through it. Or this is what happened with my patient. Did anybody else have this happen? How did you handle it? So I hope that answers your question, because at least the focus of our project was more on
Like the
implementing.
feasibility of
Yeah.
implementing, and yes, if students would have any interest in continuing VR simulation in the future. I did want to say though that prior to implementing this VR simulation experience, students in the sim lab anyways did not have any sort of scenario where they were taking care of a client with living with dementia. Again, they did do a rotation at a long-term care facility, and they did have kind of a more observational than hands-on experience at the memory care unit at one of our local long-term care centers. But prior to the OMS simulation and the VR experience, they did not have a simulation experience related to dementia, unfortunately.
Thank you, Rebecca. It's Susan, and thank you for a wonderful presentation. I have a question that has to do with gaining peer buy-in. There's a number of students in the room with me here at USB that are faculty in other countries, Oman and other. And if they were going back and wanting to start an initiative like this, do you have any lessons learned and any like speed bumps you ran into in getting buy-in from your peers, and any advice to give them if they do endeavor to try and get the buy-in from their institutions and peers to undertake such an initiative? Thank you so much.
Thank you.
Thank you. So Vicky was actually kind of the one that spearheaded the whole writing grant funding and trying to implement and bring VR to the Altoona campus. Some of the I don't want to say issues, but speed bumps, I guess, as you said, that we ran into was a little bit of buy-in from our faculty peers and colleagues, those who maybe aren't too familiar with technology, or I guess maybe, I don't know, didn't want to maybe implement something new, kind of shied away from it a little bit. So Vicky did take a lot of the work of implementing the VR at the Altoona campus. So again, I think having one designated person as the VR, I guess, quote unquote, champion would be very helpful. And then I think also in future, I guess, holding like maybe a little bit of an educational seminar for our faculty to teach them how to use VR. And then maybe that could, I guess, maybe increase a little bit of buy-in just for our colleagues of using it in future semesters. So
And I think some of it too is just finding where to put it. So there's so much in nursing education that they have to get through as far as topics and information and reading and exams, that there's very limited class time. We were very fortunate in that for Rebecca's geriatric course, we are close to campus, that they were able to come back to campus to do this. So we did it as a post-conference, and that's how we fit it in. Taking and putting VR into a campus would be something that you would have to kind of pre-plan for that. At our campus, we have up to 15 headsets, and I know that we've done like a day where 405A did the sepsis one, and that we rotated and rotated and rotated. So some went to simulation, some went to VR, some went to, I think, case studies. So everybody got the opportunity, but with only 15 headsets, and you always want to keep a couple charging, and a couple just in case there's any technical issues. We tend to do about 8 at a time max. So when you have 50 students, that's a lot of students to rotate in. So that's why we did it in clinical. So that's just from our standpoint, some of the issues of getting the buy-in from our faculty is just where to put it so that every student has the opportunity to do
Yeah,
it.
a lot of organization and
Mhm.
logistics. And I know we need to get to Mike Evans' question, and there's several in the chat as well. But just to quickly tag on to that, I wanted to ask you about sustainability, because as you mentioned, it's $50 to $100 per student per scenario. And I know, that came up with, reviewing the grant, because it is kind of a one-time use to some extent, right? There's the equipment that can be long-term. So any thoughts about that? Because that might be helpful for our PhD students who are thinking about taking it back with them too.
So depending upon the OMS software that you use or whatever software company you use, the more people you have on it, typically the cheaper it becomes. I know that for our campus, we got a grant. I know a couple of the other Commonwealth campuses, they were using it to teach like Foley catheters. That faculty member put the $50 in as like what you would typically use for a book. They would put that into the course fee. We're still at the point where we're trying to find the stability and the money to continue it on so that we don't overburden the students. So looking at our fees and what they purchase, is there a textbook that uses it as well? Is there perhaps ATI that our students have? Is there something that we can use? While not immersive, there are VR videos for YouTube. So like in our PEDS class, Dr. Danielle Peterman, she uses an autism party, which is a free immersive video that when you put the headset on, it's like you're a pediatric patient with autism. So they go through and talk about autism and almost do like a concept map, and then they watch the video, and then they come out and they say, okay, if you're taking care of an autistic child in the acute care setting, what things are you going to have to think about? So the noises, the textures, the gowns, all the things that perhaps you're not thinking about, you've just experienced that to some degree. How does that impact you?
But there's also different companies I think that you were looking into to see if maybe the price would be a little bit cheaper. But then you also kind of have to look at price versus quality, or I guess rigor of the software as well.
Yeah. So I guess the long, short answer of it, we're still looking into it.
Sure, understandable. So Dr. Evans.
Hi, Vicki and Rebecca. I just wanted to say thank you for bringing this innovation to the Ross and Carol Neese College of Nursing on such an important topic. I think I'll make 2 comments. I think regarding sustainability, it'll be less of an issue in the future. My 9-year-old walks around with his Oculus headset. So kind of like back, I'm getting old now. Everyone used to sit in the computer lab at colleges. Now everyone has their own laptop in classes. I think you'll see that transition over time. You're still gonna have to buy software, but I think the headsets is just something we'll have, and students will be expected to have their own. Whether it's smart glasses or headsets, I imagine they're all going to be able to function with them at some point. So kudos there. I was about 3 or 4 years ago, guys, involved with an educational project that I really enjoyed. And I think one thing you could look at, this is just an idea, is concept map scores, assuming you use some type of rubric or something pre-post scenario,
That's a good idea.
and tie it back to clinical judgment.
Mhm.
I have no
Sure.
questions. I've seen your posters. I've seen your work. I love it. I'm a supporter. Kudos to both of you. Great job.
Thanks, Mike.
Thank you.
We have Tracy Curtorillo. Sorry, Tracy, I'm not sure how to pronounce your last name. Mentioning so fascinating. I love how technology is helping our future nurses. It would be neat to have this available in various hospital settings to assist with new hires and new nurses. Annette says, great presentation. We just trialed this at Scranton campus. The feedback from the students was 100% positive. I appreciate the time breakdown for orientation, pre-brief, etc. The presentation was spot on, she says.
Thank you. And we've used it in some other classes as well. So like I teach nursing 452. Media Commons Virtual Speech is a software company that the university has a pilot on. So we used it to teach negotiation and communication skills. So you basically speak as though you're negotiating your nursing contract, and it gives you feedback, not only in what words you use, but did you make eye contact? How is your body language? We also used, I don't know if anybody else has used it, but after what happened like at UPMC York and the violence against nurses, we did a scenario looking at de-escalation. So it's not just, the typical clinical, you do a Foley, you take care of a patient, but okay, you've got a family member who, in this case, it was actually Mr. Winifred's family member who was taken up, and his daughter came in and was upset because she couldn't go and see him, and where's my father? You have to de-escalate that situation. So it teaches them kind of the hard skills of Foley's and injections, but it also will teach them that communication part that I think, especially when you look at some of the younger nurses and the COVID generation, perhaps have not gotten the education as far as communication skills.
Well, and even getting that theoretical content, to be able to apply it to a real life situation is a whole different thing sometimes. So that's cool. Calais Crimmy says, great work, Rebecca and Vicky. Has there been any work you or others have engaged that looks at the longitudinal impact of VR and how it translates to the development of students' skills, such as critical thinking or judgment in the clinical setting? I similarly, as you were talking about kind of the assessments you were doing, was thinking about how some of this could be related to competencies, because we know that, competency-based education is, a strong movement, and and we're doing a lot at our college related to that. So
Right. Absolutely. Thank you. Thanks, Clay, and thanks, Janice. As for looking into studies, I personally have not looked into studies looking at the longevity of implementing VR in nursing programs, though I do think kind of going based off what Clay was asking and what another viewer had said before about implementing VR, it would be nice to implement VR in a hospital setting. I think it's overall a great tool to assess somebody's quick thinking, critical thinking, clinical reasoning, competency-based learning, and I guess nursing strategies or nursing competencies in those high-stakes environments where our nursing students most likely won't have the opportunity to experience in the clinical setting. And before they go into the hospital setting, it would be nice for them to experience that, see how they would react, get feedback on it, so maybe it can help them in the future whenever they would experience those scenarios. So
lots of messages in the chat, including many positive comments related to the presentation. Nawal, one of our affiliate PhD students, says, thank you for this excellent presentation. Would it be possible for me And I suggest there's probably more students that would like to ask this question, to attend one of your VR sessions as an observer. I'd appreciate the opportunity to learn more about the process, even if just watching rather than actively participating. So maybe that's something we can explore with our center, is to provide an opportunity for the students either to experience it or to come and shadow and observe this. So
Yeah,
Right.
definitely.
Yeah, absolutely. It might help with a little bit with that buy-in question that Dr. Loeb asked about. But sure, if anybody would like to kind of observe and see what implementing VR is all about, feel free to reach out to the CGNE. I believe Janice gives their email address, or you can reach out to Vicky or I, and we'll see what we can do for you guys. Thank you.
thank you very much. That's
Mhm.
great, gracious of you.
Mhm.
Light says, wonderful and interesting area of research. Thank you, Vicky and Rebecca. Ahmed says, fantastic work. Joanne Krug says, as a faculty who's worked with VR with Vicky and Rebecca, they have a well-planned process, extremely similar to how we operate in the clinical setting, making it easy for students to adapt and use well. So
Thank you.
kudos for
Thanks,
that
Jen.
piece of it as well.
Mhm.
So
And VR is not just something in nursing. I mean, we got into it because we were looking at it, other disciplines. So when I went to Media Commons, it was actually business and marketing that was, using it. So they were looking at marketing for those Dyson hair dryers that they had. They're like $500-600. They would put it in for looking at how you would market a $500 hair dryer to hairdressers. So they would have a virtual reality where a hairdresser was using a Dyson's or whatever brand's very expensive hairdryer so they could try it out. And so, there was a class that was using the yoga room to do meditation. So we got kind of looking at it, well, what can we do in nursing? Because other disciplines are using it in theirs.
that's awesome. We have many nursing alum as well as retired nursing faculty on this presentation today. Again, many positive comments, including how really great this was as an orientation and an overview for what's coming, for sure. Allison Hawk says she used VR Sim as a flipped class for mental health this semester, and the students asked for more. The debrief afterwards was amazing and for learning moments. So
Yeah.
a lot of valuable information there. So any other questions that people may have?
I just have a quick question in terms of just a simple yes, no about the VR simulation. Does it provide any feedback to you on how the student does? Or is it more just kind of they go in and do it and the feedback is coming from the student?
We can get the feedback as well. So we can go in there and see how they did. So in this case, we had so many licenses. So we put them in as, headset one was headset one. If they were to get it, purchase their own, we can actually have their own username and password, and then we can go in and view what their score was.
That's fascinating too. I also loved that you partnered with the IST student interns. That was innovative because, as you described, it helped take care of a lot of the technological aspects, the setting up, the battery changing, decontamination, even assisting the students with the technology part of it. So, that was a great idea. I'm afraid we're running low on time. We only have 1 minute left. So I just want to take that last minute and thank all of our participants for joining us today. I agree with all the very positive comments in the chat that this was truly a fascinating presentation, a very innovative teaching strategy. So thank you so much for sharing it with us. And we look forward to learning more about it moving forward. And, maybe we can create some opportunities for students and others moving forward as well. So thank you so much. Reminder to participants that the evaluation link will pop up in your browser when we end the seminar. So please complete it at that time if you can. Otherwise, it will be sent to you via email within 24 hours, and it needs to be completed within a week if you're seeking RN contact hours. But of course, we encourage everyone to give us feedback. So thanks so much to everybody. Have a great rest of your this beautiful sunny day. Have a great day.
Great.
Thank
Thank
you.
you. Thanks for having us. Have a great day, everybody.
Thank you.